Update on coronavirus. The World Health Organization has declared coronavirus a global pandemic. As of today's reports, the global number of confirmed cases of COVID-19 surpasses 100,000. As we mark this solemn moment, the World Health Organization reminds all countries and communities that the spread of this virus can be significantly slowed or even reversed through the implementation of robust containment and controlled activities. It's been recorded all over the world and it's spreading rapidly. The coronavirus isn't spread through the air. It's spread through droplets expelled through cough and sneezes from infected persons. The droplets stay suspended in the air for a short time and settle on surfaces like tables, door handles, and metal surfaces. It will live for 12 hours, so washing hands well with soap and water is enough. People at higher risk include older adults and people who have chronic medical conditions such as lung and heart disease, as well as diabetes. Let's adhere to the following guidelines and we'll be able to manage the situation. Coronavirus is large in size. For this reason, any face or nose mask can prevent its entry. When coronavirus falls on the fabric, it remains for 9 hours, so washing clothes or being exposed to the sun for 2 hours meets the purpose of killing it. Coronavirus lives on the hand for 10 minutes, so putting an alcohol-based sanitizer in the pocket meets the purpose of prevention. If the virus is exposed to a temperature of 26 to 27 degrees Celsius, it will be killed, as it does not live in hot regions. Wash your hands with soap and water frequently. Cough into your elbow, and if you use a tissue, remember to throw the tissue away immediately. If soap and water are not available, use a hand sanitizer that contains at least 70% alcohol. Cover all surfaces of your hand and rub them together until they feel dry. Do not touch your face with unwashed hands. Stay at least 1.8 meters away from anyone who is coughing or sneezing. Adherence to these instructions fulfills the purpose of preventing the virus. The International Federation of Red Cross, UNICEF, and the World Health Organization issued new guidelines to help protect children and schools from transmission of the COVID-19 virus. We can do this by providing children with information about how to protect themselves, promoting best hand washing and hygiene practices and providing hygiene supplies, cleaning and disinfecting school buildings, especially water and sanitation facilities, and increasing airflow and ventilation. It is, however, good to note that infections in China are finally starting to slow down. Looking at the number of active COVID-19 cases around the world, it is important to mention the number of confirmed recoveries. China's drastic measures to contain the coronavirus appears to be having an impact and has reported only 40 new cases compared to 4,000 new cases discovered daily in February. While the virus continues to spread elsewhere, with at least 38,000 confirmed cases outside China, recoveries are still rising steadily. As of March 11, 2020, there were 119,000 COVID-19 cases and 66,000 recoveries, most of them in China. That's according to the tracking by Johns Hopkins University. However, steps towards the discovery of a cure or vaccine is underway in the Nigerian Center for Disease Control, the African Center of Excellence for the Genomics of Infectious Disease at Redeemer University, Ede, Nigeria, and other partners who have reported the first genome sequence of SARS-CoV-2 from Africa, from the first confirmed cases of COVID-19 in Nigeria. Remember to follow the guidelines and stay safe. Thanks for watching HealthAfrik on AAUTV. I am Bridget Denteh.